Diverticulitis is an inflammation of the bowel which is characterized by the presence of diverticula. Diverticula are small pouches of the bowel wall which can get inflamed and can give rise to abscesses, bleeding, or perforation. Depending on the type of diverticulitis that develops, there can be subtle symptoms, which are low abdominal pain, particularly on the left side, low-grade temperature, and change of bowel habits. Those symptoms are very non-specific and common, and they can be mistaken for food poisoning, irritable bowel, or other conditions. We don't really know the causes of diverticulitis. Conventional wisdom was that eating too little fruits and vegetables can cause it. Unfortunately, that's not the case. We now know that there are certain genes predisposing to the development of diverticula, and we know that diverticulitis runs in families. We have patients whose siblings or parents are also diverticular sufferers. We have even identified those groups of genes, and there's a lot of ongoing research on this issue. The genetic predisposition for development of diverticulitis is particularly true in the case of younger patients. The other conventional wisdom was that diverticular disease is a condition of the elderly. We now know that a lot of people in their 40s and even in their 30s develop it, and in those patients in particular, the genetic predisposition is very important. In the past, the primary treatment for diverticulitis used to be surgery. This is no longer the case. We now know that in around 90% of diverticulitis cases, medical treatment will be all they will going to need, and only a small group will require surgery. Those who require surgery are the ones who have either too many or too dangerous episodes and are at risk of complications. The remaining patients can be treated with a combination of antibiotics, probiotics, medications that act on the inflammation of the bowel, dietary management, and follow-up for their symptoms with appropriate investigations. The majority of diverticulitis cases settle on their own. There is even dispute by some whether antibiotics are necessary for all cases. However, there are some cases that if left untreated, they will lead to development of abscesses inside the abdomen, formation of fistulas, which are abnormal communications with other organs, such as the bladder or the vagina. And of course, in some cases, there can be a free perforation of the bowel into the abdomen, the formation of fecal contamination, fecal peritonitis, and the requirement for emergency surgery and formation of a colostomy. In order to avoid all that, if you have a known history of diverticulitis and you have symptoms, a doctor has to see you and assess you clinically and also with other tests while you're having the symptoms to determine how dangerous or non-dangerous your condition is and direct the treatment accordingly. If you are aware of your condition and if you seek help in time, then it is certain that diverticulitis can be managed very successfully, either medically or in the event of surgery, surgically, because nowadays surgery is safe and is done by trained colorectal surgeons with excellent results when required.